Prime Minister is about to push the brakes on easing lockdown.
On Saturday, the 1st of August, you'll remember we had hoped to reopen in England a number of the higher risk settings that had remained closed. And today, I'm afraid we're postponing those changes for at least a fortnight.
That means places like casinos, bowling alleys and ice skating rinks will stay shut, and close contact beauty treatments can't happen. In England, there's also a new slogan, hands, face, space. That's wash your hands, cover your face and make space. Standing with the Prime Minister, the Chief Medical Officer gave a stark warning.
We have probably reached near the limits or the limits of what we can do in terms of opening up society. So what that means, potentially, is if we wish to do more things in the future, we may have to do less of some other things. And these will be difficult trade-offs, some of which will be decisions of government and some of which are for all of us as citizens to do. But we have to be realistic about this. The idea that we can open up everything and keep the virus under control is clearly wrong.
This is why changes are happening. The crucial R rate, rating the disease's ability to spread, in the UK went up to between 0.8 to 0.9. In England, that figure is 0.8 to 1. The two highest regions are the North West and the South West. Both of their ranges are between 0.8 and 1.1. Ranges over 1 mean the virus is spreading. Cases in England are going up for the first time since May. Data from the Office for National Statistics shows there are around 4,200 new infections compared to 2,800 a week ago. This was a shock to a lot of people today, but can we expect more of this in the weeks and months to come?
I think there will be changes like this, and they will come regularly and rapidly. And we all need to become epidemiologists and understand why these things are different from those things. That's really important because the specifics will be a shock, but we ought to understand why it's happening.
For Graham, who's a British champion figure skater, along with his dad, who's a coach, today's announcement was devastating. Ice rinks are among those not allowed to open.
This is like less than 24 hours. We've got everything ready. We've been into the rink for training. You know, we've got one-way systems. We've got the social distancing. Everything's got to be cleaned. You know, and then suddenly, oh no, not tomorrow. And again, we were told that, you know, for the 4th and the 25th. You know, on the 25th, they said, oh, when they said we actually could open rinks, and then they said it was a mistake. The government shouldn't be making mistakes like that.
Another venue staying shut is Wigmore Hall in London. Empty seats waiting for a concert that can't happen. Were you shocked by what you saw today?
No, because I had actually joked with the musicians about it yesterday, so the only thing that can go wrong now is that we're told we're not going ahead by the government. So I don't think I jinxed it, but it's good to always be ready. It's disappointing, and we need to find a way forward for the arts community. All live performance, theatre, the West End, live performance right throughout the country.
We've had a few months of less restrictions. Pubs pouring pints, restaurants opening, and hairdressers giving those all-important haircuts. But now, the increased freedom we'd hoped for has been put on hold for at least 2 weeks.
Well, millions of people are coming to terms with new restrictions which were suddenly reimposed last night across large swathes of northern England in a bid to control spikes in infections. 3 regions are affected by the new measures: Greater Manchester, where we are now, parts of East Lancashire and parts of West Yorkshire. It includes cities and big towns like Manchester, Bradford and Blackburn. The restrictions on meeting people from different households will also apply in Leicester. The Health Secretary Matt Hancock said the government had to act fast, but local politicians have accused ministers of causing confusion and distress over the way the new rules were announced. Our North of England correspondent Claire Fallon has this report.
Lockdown 2. This time, it's not stay at home. It's not that simple. And it's not all of us. Instead, 3 cities, many more towns, and millions of people in a large part of the north of England waking up to find out the rules had changed overnight.
Absolutely ludicrous decision, ridiculous.
The rule change and how to enforce it, with friends not allowed to meet in bars and restaurants and different households having to stay apart, has got Bobby fizzing with rage. But it's also the timing, announced the night before Eid.
But the fact that you do it the night before, it raises suspicion, isn't it? It makes the mind wonder. People have made plans months in advance, and now we're told that that can't happen. So people are going to do it. Unfortunately, people are going to do it.
People will go ahead and meet
people will do it. And that's against the law now.
The data on the virus and the areas where the numbers have been high has led to claims about some being more to blame than others. And today, an MP for one of the areas being relocked went a step further.
Sections of our community that are just not taking the pandemic serious.
So is the Muslim community?
Of course. And if you look at the areas where we've seen rises and cases, the vast majority, not by any stretch of the imagination, all areas, but it is the BME communities that are not taking this seriously enough.
Blimey.
With names and numbers for track and trace, shorter prayer times and masks and strict social distancing inside. At this mosque in South Manchester, they've been planning for today for weeks.
Obviously, there are some people who may not observe the rules, but that is across the board then. It is not, again, something which is present only or prevalent in one denomination. And it would be unfair to suggest that, I think.
Here, last night, there were phone calls, questions and a scramble to work out if they'd be able to open their doors today with the change of rules. All not helped by how late it happened. Announced on Twitter by Matt Hancock at 9:14 p.m. He said, "We're constantly looking at the latest data on the spread of coronavirus. Unfortunately, we've seen an increasing rate of transmission in parts of northern England. The spread is largely due to households meeting and not abiding to social distancing," adding that the changes would come in from midnight.
Is this effectively a lockdown?
This is targeted, specific action, and I understand the impact it has.
23 bookings for today.
Understanding the impact is tricky, though, if the rules aren't entirely clear. Last night, it seemed pubs would be unaffected. By this morning, we were told meeting mates down the pubs is not allowed.
We opened mid-March for 2 days. We had to close again on the Monday.
Having finally got this place open, Jamie told me he's now confused, but also worried.
Are the police going to come around and check and do spot checks or on tables in the restaurants if they aren't in bubbles? Again, there's a lack of information. We're not really sure how it's going to go this weekend. We've had to check the bookings, actually. We've had 3 or 4 table cancellations for the weekend.
Because presumably people have booked a table for them and their friends and they're not in the same household together.
Yeah.
For millions of us, the new rules mean no barbecues at a friend's garden, no grandparents doing childcare unless in a bubble.
If you've got grandchildren, you're missing all the time, aren't you?
This is Henshaw Street in Stretford. We came here during week 1 of lockdown.
Today has just been a bit of a kicker. Kids were a bit upset. We were going to take them down the other day, we forgot, didn't we? Because we realised they're not so bright and probably a little bit depressing.
I think we might make some new ones.
Well, we did ask for a government minister to appear on the programme, but none were available. Joining me now, though, is the Shadow Foreign Secretary and Labour MP for Wigan, Lisa Nandy, who is in her constituency, which is also affected by the new restrictions. Welcome, Lisa Nandy. First of all, you've described how the government's handled this as an absolute shambles. What would you have done differently?
Well, we've been pushing the government for months now to take the fact that this may happen seriously. And in Greater Manchester, actually, there's been enormous frustration. The information about tests hasn't been shared for quite some time. Local leaders here, council leaders and the Mayor, Andy Burnham, have been pushing the government to do that because in the end, when these local spikes come, and we've seen them come in large swathes of the world, including many European countries in recent months and in Leicester as well, it's public health directors and local council leaders who have to put those plans in place to keep people safe and bring communities with them. And instead, the government has been pushing back about that and ended up last night and not just announcing this on Twitter with very little detail, but also hastily convening a group of MPs, of which I was one with 15 minutes notice, to subject a minister to a whole barrage of questions that she just quite simply couldn't answer about what people were meant to do when guidance came into force in 3 hours' time that hadn't even been written yet. The government has got to get better at planning for these things, otherwise they will lose public confidence, and that could be really serious.
So is it the communication of the policy that you have a problem with, or the policy itself?
Nobody's arguing, as far as I'm aware, that locking down quickly when it becomes apparent that there are rising numbers of cases, and it has in Greater Manchester in the last week. Nobody is arguing that that is the wrong thing to do. Keeping the public safe is obviously the first priority. But we've known that this might be coming for several months now, and there should have been plans in place. So I had people contacting me last night to say, if my grandparents can't come and look after my kids, how am I going to go to work? We've still, 24 hours later, got huge problems with that. The Prime Minister is saying that tomorrow he is going to change the guidance nationally so that home working is no longer the default. And yet across large swathes of the north of England, including here in Wigan, people can't rely on their grandparents now to come and look after their children. It's the school holidays. This is a crisis for many parents, and yet the Prime Minister, he could take steps very quickly to help us with that, but he hasn't done it. He's refusing to and is pressing ahead with this. It's just one example of the very many things that are causing real anxiety for a lot of people that could be avoided. We could be in a far stronger position than this. He says he wants to get the economy moving. This is no way to do it.
Well, there is also some anxiety about whether communities are being singled out, chatter about whether this was brought in because of the Muslim festival of Eid. One Conservative MP has said that he believes the immigrant and Asian population aren't taking restrictions seriously. What do you think about that?
Well, first of all, I think that's incredibly divisive. The way that most countries that have successfully handled COVID have done so is to bring people with them, not blame or scapegoat particular groups of people. But it's also, if you don't mind me saying, utterly stupid and wrong-headed, because here in Greater Manchester, for example, one of the areas where we've seen the biggest rise in cases in the last week is in Trafford, which is one of the boroughs in Greater Manchester that has the lowest proportion of BAME population in the whole of Greater Manchester. And the leader, the Director of Public Health for Trafford, was out this morning saying, look, the big problem, as we're seeing in Europe, is that people, young people in particular, have been told that they can go out, they can go to pubs, they can socialise with their friends again. And that is what is driving the spike in cases. In Trafford, I think it's about 57% of the new cases that they're seeing. Now, I'm not blaming young people for that, but it is absolutely ridiculous to start blaming BAME people, particularly given that here in Wigan, it's doctors, nurses and care workers, public transport officials who've been keeping things going for us, looking after our families, who come from those BAME backgrounds, who've often paid the highest price. It's just utterly wrong-headed.
OK, thank you very much, Lisa Nandy. We're going to have to leave it there. With me now is Hamad Khan, Chair of the Executive Committee at Manchester Central Mosque. Mr Khan, thank you very much for joining us. How confusing was all of this last night?
Extremely. We'd spent 2 weeks making preparations for the Eid, and the news came, I heard it about 9:25, 9:22, and it was panic stations. Everything we'd prepped for 2 weeks was literally we were unsure as to what was going to happen. We had a congregation to support, we had to get the messages out, and it was extremely difficult to find the right guideline at the right time. So it was very, very confusing straight away, yes.
Are you clearer about what you're allowed to do now? Because there has been a lot of confusion. I mean, people are saying you can pop down the pub, but you can't go and visit your grandmother's in her garden.
Yes, the confusion is still there. We are certainly clearer from the extent of the places of worship that they can operate providing they are COVID compliant. But the confusion still lies as to who can go where. So could people from Manchester and Greater Manchester go to visit a family member in the West Midlands area? Could somebody from the West Midlands come and see them? We don't know.
What do you think about these accusations that immigrant and Asian people haven't been following the guidelines?
I think that's utterly unacceptable. It's very disappointing. Comments like that are very, very divisive, and people who make comments like that shouldn't really be given any airtime. I believe that it is in an effort to divide our communities instead of helping and join everybody together in a pandemic. And it is a problem which is worldwide. It is not a problem of a particular denomination of a community. So I would certainly hope, I think the comment you're referring to is Mr. Whittaker from earlier today. I hope he apologises for it, and it is utterly disappointing to hear a member of the government to use the pandemic in the way that it was conveyed.
Okay, Hamad Khan, thank you very much for joining us.
Thank you very much.
Krish.
Well, earlier I spoke to Professor Mark Woolhouse, who's an infectious disease epidemiologist at Edinburgh University and is a member of the government's scientific advisory group. And I began by asking him if he supports the government's announcements.
Yes, this was to be expected that at some stage, at this part of the epidemic, that the numbers of cases would start to increase. We might see more localized outbreaks and larger ones. This was always going to happen as the relaxation started. What we've been doing, and countries around the world have been doing, is feeling our way gently to see what measures we can relax safely without allowing the number of cases to increase. At some point, we are going to reach the limit.
Isn't there a contradiction between putting on the brakes and saying to people who are shielding, you can go back to work now?
Well, there's a balance of measures, isn't it? People have to realise is that lockdown was always a temporary measure that simply delayed the stage of the epidemic that we see now. It was never going to change anything fundamentally. Yes, however low we drove the number of cases, the moment that we started to relax and started to relax enough measures, we were likely to see circumstances where the number of cases would increase either nationally or locally, and that's exactly what we're seeing.
Doesn't that mean that the government is pursuing a strategy in which we live with an acceptable level of cases, rather than trying to eradicate coronavirus?
Well, the way I would put it is that the lockdown was always, in my view, a panic measure to control an epidemic that was spiraling out of control because we hadn't got anything better to do. We hadn't got any better plan. So for me, the advantage of lockdown was to use that time to prepare ourselves to manage the next stage of the epidemic much better than we were, for example, in February before the first wave happened.
So this is effectively a return to a strategy of herd immunity in which you have an acceptable level of cases, it works its way through the population, and you have an acceptable level of deaths.
No, we're somewhere close to a situation of containment, as I say, where we were in February. So we are seeing localized outbreaks. We want to be able to get on top of those outbreaks quickly, bring them under control. We want to relax as many measures as we can, but the challenge is that we can't relax all of them, and we're not going to be able to without some measures that are effective in controlling this epidemic other than lockdown.
So you think we will likely see other areas of Britain going into local restrictions and local lockdowns?
I think that's very likely indeed, and this was always expected at this stage of the epidemic. As I said earlier, lockdown was always ever a temporary measure that wasn't sustainable, but it wouldn't fundamentally remove the threat of COVID-19. It doesn't change anything. The virus is still there. What changes over the last few months, or has changed, we hope, is our ability to cope with localized outbreaks and bring them under control quickly. And that is a capability that is going to be tested in the coming weeks and months.
So if you were shielding at the moment and you lived in Blackburn or Manchester or one of the places that is now under greater restrictions, and your employer said, you've got to come back to work on Monday, what would you do?
Well, I would want to make a personalised risk assessment, and that wouldn't just involve the level of infection in Blackburn or wherever it was, but also the measures in place in my workplace and what I call a chain of trust, so that the people around me would not be coming to work if they had symptoms. They would not be coming to work if anyone they knew they'd been in contact with had symptoms. They would not be coming to work if they were supposed to be quarantining, that they were also protecting me. And if I was satisfied that the people around me were behaving responsibly, then I might judge that it was safe to go to work.
Is that what you did yourself, a personal risk assessment? Because you came in for criticism for moving your family out to a remote Scottish island at the beginning of this pandemic.
Christian, that matter is under some legal dispute, and if you want Channel 4 to join the legal case, you're very welcome to. We came for a one-week holiday and got caught by lockdown like many thousands of other people around the country.
And you're still there, are you?
We are, as it happens. The community has been extremely welcoming and extremely supportive, and we're very, very grateful to them for that.
So what is the legal sort of confusion? I mean, we're obviously not wishing to join litigation, but I'm wondering what it is you're threatening when you say that. I mean, what's the confusion around what you've done?
As I said, the matter that was the reports in the press are under legal review.
So you didn't move.
Considering our
You
legal
just happened to be caught there. Is that what you're saying?
Yes, we happen to be caught there, like thousands of other people.
But why haven't you gone back? Because your job is in Edinburgh.
Yes, it turns out, like many other people, that it's entirely able to carry out this work remotely, thanks to some very fleet-footed work by my IC team at the University of Edinburgh, for which I'm grateful as well.
And so what do you say to those people? I mean, I'm not putting this allegation to you myself, but you have been accused of hypocrisy, haven't you?
As I say, if you want Channel 4 to get involved in the legal action, you're very welcome to continue this line of questioning.
I'm asking you, when people accuse you of hypocrisy for that, what is your answer to that?
My answer is the matter is legal, and I am ending this interview now. Sorry, Christian.